In a 2016 study, researchers led by Associate Professor Naohiro Okada from the University of Tokyo, Japan, found that patients with schizophrenia showed larger subcortical volume in the bilateral caudate, putamen, pallidum, and lateral ventricle. Another study in 2018 led by Dr. Okada showed that adolescents with subclinical psychotic experiences also have a larger left hippocampus, right caudate, and right lateral ventricle, along with a larger left pallidum. More recently, a 2020 study led by Dr. Daiki Sasubayashi from University of Toyama, Japan, has revealed that patients with high risk of developing psychosis also show larger than normal left caudate and bilateral lateral ventricles, while only the male subjects present an enlarged left globus pallidus. It is evident from these findings that changes in the brain structure reflect functional changes in the brain. For instance, an increase in the volume of globus pallidus was found to be linked with schizophrenia. Monitoring such brain changes may therefore be helpful in discovering psychiatric disease mechanisms. Besides, disease classification based on structural brain changes can be further improved by implementing machine learning techniques in standard diagnostic procedures, such as structural magnetic resonance imaging, or MRI. This was demonstrated in a 2022 study led by Dr. Yinghan Zhu, in which the researchers investigated whether a model differentiating patients with chronic schizophrenia from healthy participants could be applied for diagnosing earlier clinical stages of psychosis and autism spectrum disorders. They found that the classifier's accuracy was 75% for the test dataset and 76% for the independent confirmatory dataset. In this classification, the volume in the globus pallidum was a responsible feature for classifying patients with schizophrenia from healthy control participants. In summary, these studies highlight how the progression of psychiatric diseases can be mitigated by observing structural changes in the brain. This can not only help us understand the brain mechanism around the onset of psychosis, along with adolescent brain development, but also apply brain image-based diagnosis tools for psychiatric disorders to general clinical practice.